I'm Dr. Shivani Chandan, consultant obstetrician and gynecologist at Aster RV Hospital, JP Nagar. If you've been advised a hysteroscopy or if you do not know if that's the right step, this video will answer all your queries. Let me run you through what is hysteroscopy, why is it done, and what to expect before, during, and after the procedure. So what is hysteroscopy? Hysteroscopy is a minimally invasive procedure through which we can visualize the inside of your uterine cavity. It is done through a hysteroscope, which is a thin, long tube with a camera at its tip. It is usually done under anesthesia, but it can also be done in the outpatient department. So this procedure helps us to see inside the uterine cavity for abnormalities without any cuts or stitches on your body. So why is a hysteroscopy advised? Some of the common reasons for which hysteroscopy is done includes heavy menstrual bleeding, to look for any cause inside the uterus such as polyps, which is an unwanted growth inside the uterus, or to look and treat fibroids, sometimes which are present inside the cavity called submucous fibroids, to remove intrauterine devices which have been missing or in which we cannot visualize the thread, to remove retained products of conception, to diagnose and treat intrauterine abnormalities such as septate uterus, and also to treat adhesions, intrauterine adhesions, otherwise called Asherman syndrome. It's also done as part of evaluation before fertility treatments are done. So hysteroscopy is used both to diagnose the problem, in which we can see what is the problem, and also treat at the same sitting, in which case operative hysteroscopy is done, for example, to remove any polyp or any fibroid that is found inside the uterus. Now, what to expect before, during, and after the procedure? The procedure is usually done as a daycare procedure. It can also be done in the outpatient department without anesthesia. This is again individualized, and anesthesia is given for some cases. You are expected not to eat or drink anything for 4 to 6 hours prior to the procedure. During the procedure, you will not feel any pain. Mild anesthesia is given, and you will be monitored throughout the procedure. We use a fluid medium to distend the uterus, which is normally collapsed, so that we can visualize the cavity completely. After the procedure, you may feel mild cramps or spotting for a day. You are usually discharged on the same day, and you can return back to routine activities within 24 to 48 hours of the procedure. Now, is hysteroscopy a risky procedure? Is it safe? Hysteroscopy is a very safe procedure with very minimal complications such as infection, mild bleeding, or uterine perforation, which is uncommon. If you've been recommended a hysteroscopy or you're unsure, come visit us. We will help you understand if the procedure is necessary and how to go about with the procedure.